Mr. Zainal has an acute asthma. He used to take salmeterol when he is having acute asthma attack. Every 2 months, he will go to pharmacy to buy the salmeterol. At the pharmacy, Mr. Zainal asked for salmeterol. However, the pharmacist in charge wrongly dispensed the wrong medication. The pharmacist gave him salmeterol, but Mr. Zainal do not notice that and just take the medication. On the next day, Mr. Zainal is having an exercise. After he had finished his exercise, suddenly he was attacked by asthma. He immediately take his medication and inhaled it. He found out that his asthma does not relieve. Otherwise, he gets sudden onset of wheezing and breathlessness, which worsening his asthma attack.
Assalamualaikum warahmatullahi ta'ala wabarakatuh. You're watching Impact, and today in this episode we will be discussing about one of the most innocent topic in the healthcare world, which is asthmatic attack and also the drug Salmeterol. So as usual, before we start, I would like to introduce our panelists for today. The first panel is Dr. Syafiqah binti Sulaiman, a fully registered pharmacist, a pharmacy and hospital pharmacist. Our second panel is Assistant Professor Dr. Nur Akilah Zahira binti Muhammad Zuri, a fully registered pharmacist and a lecturer in Department of Biomedical Sciences, Kuliah of Pharmacy, and a former hospital pharmacist. And our last panel is Associate Professor Dr. Nur Fatihah binti Muhammad Arif, lecturer in Department of Chemistry of Kuliah of Pharmacy. So Dr. Syafiqah, as someone who has been involved in clinical settings for so many years, can you give us a rough idea on the basic things about the drug Salmeterol, how it actually been discovered?
Okay, thank you, Mr. Moderator. Assalamualaikum warahmatullahi wabarakatuh, and a very good day I wish to everyone. Okay, actually to tell the whole story about the discovery of Salmeterol is quite long, so today I will make it brief and short. Okay, this drug had been founded by Sir David Jack and launched clinically in year 1999. He was known as respiratory drug expert, as he is also the one that had founded salbutamol, which marketed as Ventolin. Ventolin still remains the most widely prescribed bronchodilator for the treatment of acute asthma until today. But then later he noticed that salbutamol have a very short duration of action. So he came up with a new idea, which is to add a lipophilic tail moiety to the head group, resulting to Salmeterol formation. Salmeterol is a long-acting beta-2 adrenoceptor agonist. It only required twice daily dosing. This was a great discovery as it gives a great benefit to the chronic asthma patient.
Assistant?
Yes, doctor.
Can you help me? I think I want to create a better drug than salbutamol.
Yes, I can help you. Didn't the drug is the best medication for asthma patient?
Yes, but the salbutamol structure have a short duration of acting in the body. So I think I want to change the structure to make it have a longer duration in the body.
I see, but how?
I think I might know the answer. Why don't we change this structure into lipophilic structure?
Doctor, why don't make this become a benzene?
I think that might work.
Yeah, that's true, doctor.
Yes, it will add the exercise to give a prolonged action in the body. Thank you, Assistant.
You are so great.
Thank you, Dr. Syafiqah. Dr. Akilah, apart from the discovery, we might also need to discuss about the medicinal chemistry of the drug Salmeterol. Can you explain a brief explanation about the medicinal chemistry of the drug Salmeterol?
Thank you, Mr. Moderator, for the questions. Now I'll explain to you about the medical chemistry of the Salmeterol, which is mainly the structure of the Salmeterol. So generally, the molecular structure of the Salmeterol is C25, 537, and O4. So it is highly selective and long-acting beta-2 receptor agonist, which is act as bronchodilator to treat asthma, chronic asthmatic diseases. So basically, this drug will be administered through inhalations. Basically, there is two main sites of the salmeterol. The first one is the benzene site, and the second one is aryl group attached with the site change. The presence of the benzene is resemble the structures of the catecholamine. The second one is the presence of aryl group with site change. The presence of this group will increase the lipophilics of the drugs, which will practically increase the selectivity of beta-2 receptor agonist receptor. So, salmeterol will also simulate the intracellular adenyl cyclase to catalyze the conversions of the triphosphate to cyclic 3,5 adenosine monophosphate, which is CAMP. So when CAMP is increased, it will cause the relaxations of the bronchial muscle, which followed by bronchodilations and increase the bronchial artery flow.
Thank you, Dr. Akila. Okay, now we have known and understand about the structure of the drug. Now let's move on to the mechanism of action of the drug. How can actually the drug performs its action as a beta-2 agonist? Maybe our third panel, Dr. Nurfatia, can give us a clear view pertaining to this matter.
Thank you, Mr. Moderator. Assalamualaikum warahmatullahi wabarakatuh. Okay, today for my part, I will explain about the mechanism of action of salmeterol. Okay, basically it is a beta-2 agonist, long-acting beta-2 agonist, which also known as LABA. Okay, now I will explain why it is categorized under LABA. This is very close related to the medicinal chemistry of salmeterol structure. The long lipophilic part of the salmeterol will bind to the exocyte, which is a region near to the beta-2 receptor. Then, it helps the action of active portion of the drug to bind and unbind for a long period of time with the beta-adrenergic receptor. The prolonged stimulation of the circular smooth muscle of bronchus will result bronchodilation. This is very close related to the medicinal chemistry of salmeterol structure. The long lipophilic part of the salmeterol will bind to the exocyte, which is a region near to the beta-2 receptor. Then, it helps the action of active portion of the drug to bind and unbind for a long period of time with the beta-adrenergic receptor. The prolonged stimulation of the circular smooth muscle of bronchus will result bronchodilation due to the relaxation of the muscle. Thus, the airflow of the bronchus increases as the circular smooth muscle relaxes. Plus, salmeterol also gives effect to endothelial and mast cell of body. Okay, the result of this stimulation will decrease the vascular permeability and reduce the release of inflammatory mediators. Okay, for asthmatic and COPD patient, this drug is very useful in order to ease their respiration. Thank you.
Thank you, Associate Professor Dr. Nurfatia, for the explanation about the mechanism of action of drug salmeterol. Okay, now some of us might be asking, is there any complication or side effects of the drug salmeterol? Okay, to answer this question, we might need to watch this video first.
Miss A has chronic asthma. Because of that, she has been on salmeterol for quite a long time. It has been her routine to take salmeterol before and after finishing her works. Months by months, Miss A is still taking salmeterol. There wasn't even a single day of her forgetting to take this medication. One day, her day isn't going smooth as usual. She experienced headache and cannot do her work properly. Her symptoms become more prominent. Her headache getting severe and she starts coughing. Aside from headache and coughing, Miss A started experiencing musculoskeletal pain. Suddenly, Miss A having dyspnea because of paradoxical bronchospasm. Her breathing getting worse and worse. Luckily, her sisters noticed that and immediately calls the emergency number 999.
Alright, based on the video, it can be clearly seen that the drug Salmeterol can be used in prevention and maintenance of asthma symptoms such as headache, cough, and musculoskeletal pain. And also, it is a long-acting beta-2-adrenergic receptor agonist or LABA. Due to its vasodilation properties, the common side effects of Salmeterol include dizziness, migraine or headache, and also sinus infection. In most cases, Salmeterol side effects are minor and either not require any treatment or can be easily be treated. However, certain side effects such as paradoxical bronchospasm may lead to fatal and also need a healthcare provider immediately. Some of these more serious side effects include a very fast heart rate and also high blood pressure and worsening breathing problem. Now, the serious question here is the drug Salmeterol is actually the drug of choice for the acute asthmatic attack. Maybe our first panel, Dr. Shafika, can explain about this question.
Okay, actually that is a very good question. So the question just now is, does Salmeterol suitable to use for acute asthmatic attack? So the answer is definitely no. This situation was shown in the first video, in which the desired effect is not achieved if Salmeterol was given to treat acute asthmatic attack. The sole reason is due to its relatively prolonged onset of action. Salmeterol is contraindicated for use in patients with an acute asthmatic attack. So if patient with acute asthmatic attack consume this drug, the effect of this drug cannot be shown quickly and it can harm the patient, and in some worst case scenario, the patient may die. So for acute asthmatic attack, salbutamol is the drug of choice. On the other hand, Salmeterol is only prescribed if the patient has severe asthma and it cannot be used as a monotherapy treatment. Usually it is used for add-on maintenance therapy along with an asthma controller medication. Generally, Salmeterol was designed for exercise-induced bronchospasm and for COPD maintenance treatment.
So we have come to the end of this episode on asthmatic attack and the drug Salmeterol episode. It can be concluded in this episode that the drug Salmeterol is clinically important and it is also a long-acting beta-2 agonist. However, it must not and should not be used for acute asthmatic attack. It only must be used for chronic asthmatic attack only. That's all from us. Thank you for watching and stay tuned for the next episode on Impact.